Friends, good afternoon. I am Dr. Suresh Pandey and you are watching a case of mature cataract with corneal astigmatic where I am going to implant a toric intraocular lens. So friends, you can watch the first step for implanting the toric lens is the reference marking which was done on the slip lens, and this is what I am going to do here is axis marking, and here you can see I am marking 90 degree axis. The axis marking is being done, and once we do the axis marking, you can see this is 90 degree, so I will be putting my incision here. And the first step for the surgery is the side port incision. In this case we are going to do toric lens implantation. This is a case of mature white cataract with corneal astigmatic of about 3.25 millimeter to 3.25 diameter, and the first step is the side port incision, and this is followed by the injection of intracameral lignocaine. Then we are going to stain the anterior lens capsule under an air bubble. So this is the triactin blue dye being injected in the chamber, and you can see the beautiful staining under the air bubble. And we are going to inject the dispersive viscoelastic, which is the combination of chondroitin sulfate and sodium hyaluronate. And now I am going to perform the second side port incision, and this is the second side port incision which is done here. And now this is the main incision which I am going to do now. The main incision is 2.8 millimeter. You can see the main incision is on the steep axis, which is 90 degree. So this is 90 degree, and this is my main incision. And now I am going to do capsular axis, and to start the capsular axis I am going to use straight 26 gauge needle. Just going to make a nick, and you can see I have made a nick, and there is a milky fluid coming out. So I am going to suck the milky fluid with the 26 gauge needle, and here this is the capsular very nicely visible, and I am going to do the capsular axis, which is about 5 millimeter in size. This is the capsular axis, and now I am going to perform the vertical chop technique. I am going to use the sharp chopper. See, this is the phaco chop technique. I am using sharp chopper. You can see that I am holding the phaco with my left hand, and I am using the chopper with my right hand. So first step is just to impale the nucleus. So notice that I am holding the phaco vertically. This is vertically, and see I am going deep inside the nucleus, and I am holding, see such a good hold. Now I am going to just chop with the vertical chopper. See the beautiful chop. You can see nice chop here, 2 pieces being done, and then I am just going to rotate it like this way, hold it again, and then chop it again. You can see, and then the half of the nucleus is being chopped nicely, and we can remove it. As you can see, these pieces are free. So before performing the chop of remaining half, I am just going to coat the endothelium with the dispersive viscoelastic. The logic behind coating is that I want to minimize the endothelial cell loss, and then after coating the corneal endothelium with the dispersive chondroitin sulfate based viscoelastic, I am just going to go again and then hold the nucleus. This is my sharp chopper, and you can see the beautiful chop being done. And this is another chop. So you are watching live from the OT of SuVi Eye Institute and Lasik Laser Center, Kota Rajasthan, and this is the last piece of the nucleus, white cataract with corneal astigmatic, and we are going to perform toric lens implantation in this case. And right now I am going to this is my last piece, and this is the last few nucleus which I am going to remove. And here you can see the last nucleus is out, and now you can notice the nice red reflex, and I am going to remove the cortical matter, clean the cortical matter with the bimanual irrigation aspiration, and we are going to implant the toric lens. You can see I am just doing the cortical cleanup, and so here the cortical cleanup is being done. In white cataract, not much cortical matter is there. You can see there are some posterior capsular fibrosis is there, and sometimes the posterior capsular fibrosis you need to do the posterior capsular axis. In this case, we are going to implant toric lens. So I am just going to do polishing here. As you can see, this is posterior capsular polishing being done, and now I am going to implant toric lens. So you can see this is the toric lens from Biotech Vision Care. This is hydrophobic acrylic toric lens, 21.5 diopter with cylinder of 3.75 diopter at the lens plane, and you can see this toric lens, and here are the marking of the toric lens. You can see the marking. So once you take out this lens, so you will see these two marks here and here. So these are the marks. Here you can see this is the mark here and this is the mark here. So these are the marks for toric lens. So every company has different kind of mark for toric lens. Toric lens from Johnson & Johnson Vision Care, it contains the dots, while toric lens from the Biotech Vision Care contains the small line. So once you put the lens in the cartridge like this, and then you just put the haptic over the optic like this, then carefully close the cartridge, and this is the injector system, and this is the injector from Biotech Vision Care, and you can see this injector. And now we are going to implant toric lens. So we are going to implant the toric lens with hydroimplantation technique. This is the hydroimplantation technique. So here I am just going to go inside with the irrigation port, and this is the toric lens coming out. You can see, you can watch. This is coming out slowly. See nicely, the toric lens is in the bag. We are going to use the dialer, and this is the user dialer. And now we are going to remove the viscoelastic with bimanual irrigation aspiration system. So this is the removal of the viscoelastic, and you can see nicely the 2 marks of toric lens, and I can just, and here I'm just going to rotate the lens, and this is the rotation of the lens at 90 degrees. And it's very important to remove the viscoelastic by going behind the lens. So I'll just I'm just behind the lens with my irrigation coat, and here you can see the lens is very nicely positioned at 90 degree axis. You can watch the 90 degree axis marks are here and here, and they are nicely coinciding with the axis marking at 90 degree. So this is the toric lens implantation done in the capital area. Now we are going to seal the injection incisions. So here I'm just going to seal the incisions, and then I'm going to just, here you can see this is the lens is nicely positioned, and the pupil is coming down now. So this is the external hydration and sealing the incision, sealing the side port incision. This is sealing of the main incision. Now I am going to inject the triamcinolone acetonide, just a very small amount, and this is the injection of moxifloxacin. So this is moxifloxacin, and now just betadine, and the surgery is over. Friends, I have done successful implantation of toric lens in a case of wide mature cataract. Now you can watch. आँख खोलिए बादल जी, कितनी उंगली है? हाँ, आँख खोलिए, कितनी है? आप कितनी हैं? आप कितनी हैं? आपको दर्द तो नहीं हुआ? नहीं हुआ ना? तो see, the patient started seeing immediately, and the beauty of modern ophthalmic surgery, modern cataract surgery is that now we have tools and technology available to deliver the best visual outcome. Friends, the cataract surgery is known as refractive cataract surgery. So any pre-existing astigmatism must be addressed. We always make our incision at the steep axis, and any corneal astigmatism of more than one diopter, we take advantage of the toric lens technology. So this is the case of mature cataract with corneal astigmatism, and I have shown you the implantation of toric lens live from the Operation Theatre of SuVi Eye Institute and Lasik Center, Kota. Thank you friends, Dr. Suresh Pandey.